Hello Floxies, this is my second video and I'm going to try to make it a little more concise and clear this time and not beat around the bush on some of the information. So I'm going to get right to it. So some of the things I've learned leading up to this I'll share with you real quick, but I want to share a major thing with you in that I am exactly 60 days into this. So right at 2 months, I'm still not really able to walk more than a couple steps. I'm still in quite a bit of pain. The tendinopathy is still very acute, but some of the psychiatric effects and the neuropathy have declined somewhat, and they're much more manageable, meaning they're not unbearable like they were before. One of the things I didn't talk about before is I feel like I've aged quite a bit. I've got a lot more gray hair, and I'm noticing some wrinkles in my skin and just dry skin constantly, which sucks. I'm 44 and I'm trying to stay young looking, and this shit is not helping. But all right, so we're gonna get right into this. So some of the things I've learned recently is that fluoroquinolines, as we know, are a class of medication that will mess you up, right? So the term Fluoroquinolone-Associated Disability has been an established entity by the FDA since at least 2015. So this is a classification, and it's not something made up by us, the patients. And you know, as I read more and more about this disability and about the medication that's behind this, the more I come to the conclusion that this is basically fluoride. So fluorine is an item on our periodical table, and there are things associated with it. You know, all the scientists that discovered fluorine, you know, are called fluorine martyrs. They died because of exposure to it. They didn't understand the dangers associated with it, and it seems that's still continuing today. So one of the things that I've been trying to do is eliminate all fluoride from my intake. So you can't detoxify if you're continually retoxifying. And what I mean by that is, you know, fluoride is obviously very bad for your health, and it is everywhere. It's scary how many places you'll find it. So obviously the water I drink, I went and got a zero water filter because it does remove most of the fluoride, like 99.9% is what they claim, over the initial use of the filter. And of course it downgrades as you use the filter, and it comes with comprehensive reading material with each of the filters that talks about location of, you know, in America, the degree to which the water is just dirty, and how often you need to change your filter and how fast it degrades as you're using it. So I really like it because it gives you so much information, and very few filters actually do remove the 99%, regardless of what they claim. If it says it removes fluoride, get a number, go in and look at the number, and you might be surprised at how little. Some of them only remove a third of the fluoride, and of course they can make claims because it's sometimes unquantified how much is in the water to begin with. So just be careful. So bottled water, be careful what you drink. So of the bottled water they surveyed, 114 brands came back positive for fluoride. That's a lot. So it's virtually impossible to go somewhere and buy bottled water off the shelf that doesn't have fluoride in it. So kombucha, you know, I'm drinking kombucha for my gut health, and come to find out kombucha can actually be pretty high in fluoride depending on the brand and where you get it. So you know, the question is, does the benefit outweigh the risks to it? And I don't know the answer to that right now. I'm continually drinking kombucha. I drink it twice a day before each meal, and you know, it's just an accepted risk. But there's a lot of things that are surprising. So black tea of all the brands they found, out of 329 items, they came back for positive. Coffee is the same way. So coffee came back with 238. So this is just a website that I looked up that just said, you know, I was asking what foods are high in fluoride. So my thought on this is that it's because they are feeding those plants as they grow, as the crops grow, with fluoride, and a combination of naturally occurring fluoride. So I'll get into that here in just a minute. But there's other ones that have enormous rates. So raisins, for example, have 2.34 parts per million. That's a lot of fluoride. Shrimp, chips, French fries, oatmeal, broth, popsicles, crab, wheat, all of those really high. Those are the highest foods. The ones that are low, nuts, yogurt, chicken, eggs. So we talked about nuts before, and we're going to talk about the benefit. I mean, I've got a bowl right here. Again, almonds, cashews, peanuts. I get unsalted by the way, table salt, unless you get kosher and very specifically get into the brand and find out if they add fluoride. Salts have been adding fluoride since 1954. Yeah, it's very difficult to find brands that don't actively put fluoride into the salt. Don't know why, because when you actually start looking up, does fluoride help your teeth? Even dentists will tell you that, and there's plenty of videos on this platform on YouTube that'll tell you that unless you're a developing baby or developing teeth, fluoride does not benefit you. So as an adult, all you're doing is causing, just like we're experiencing, fluoride or fluoroquinolone toxicity, or developing the propensity for it, because it is cumulative in your system. The other thing that you can develop is a thing called fluorosis, which is evident in your teeth. It looks like a yellowish staining, almost like you were shining a light when you look it up online, except the light coming through your teeth is yellow. That's fluorosis. That is too much fluoride. So they started putting fluoride in toothpaste because it wasn't in the water. When they started adding fluoride to the water, they didn't back off the fluoride in the toothpaste. So even kids, they're talking about the negative reactions with too much fluoride, causing fluorosis, and trying to back off. A lot of countries, a lot of states and localities have removed it from their tap water. It's not the case here, which in Alaska, which is what I thought it would be, since we've got such wonderful water coming off these glaciers. And what do? They poison it. Which is terrible, because when 99% of all water is used for industrial purposes, washing your dishes, doing your laundry, taking a bath, washing your car, or used in processes, or firefighting, and it goes right down the system out into the environment. So and it's a known neurotoxin, so we're poisoning plants, animals, sea life, all that stuff. And I wish we'd stop doing it, but getting ready to start going to the assembly meetings and trying to petition my government to stop poisoning the environment once I'm able. I am going to Minneapolis on Friday to Dr. Ron Hansen's OrthoCure, and I will keep you updated as to the results. But he is one of the few doctors that I've talked to that is extremely transparent. I asked him permission before I included his name in his practice in this, and he expressed a great interest in remaining open to public and getting more people that want to heal and want to be better in there to his office. And he told me recently he treated somebody who had the record at 35 years of dealing with this shit. I can't even imagine. So some of the information I've learned, I'm going to get into it here in a minute, is from this book right here. So it is a book by Dr. Stephen Piper, who's a German. So I tried to look him up on YouTube, and I couldn't do it because it is in German, and you have to read the subtitles. It was too much. It's a little bit too fast. But the book is called Fluoroquinolone-Associated Disability, Pathogenesis, Diagnostics, Therapy, and Diagnostic Criteria. And when I bought this book, it is $78 on Amazon for this book. And when I got it, I was a little pissed because I was like, this ain't a book. It's a freaking pamphlet. But when you start reading it, it's gold. There's so much information in here that is all together in one neat, easy to read place. Now, when you start reading this book, it's a doctor's book. So it's going to read like a doctor's book, and it's going to be eyewash. And you're just going to, what did I just read? So I'm going through here with a highlighter, and I'm writing down the definitions of words I don't know, and I'm learning. And it didn't take long at all for me to understand this. So there's a lot of things I'm going to breeze through, but I want to highlight a couple major issues from each chapter. So as you start reading this book, there's a lot of things you're going to learn that are going to bother you, and one of them is fluoroquinolone family. Right off the bat, is a reserve medication. It's a reserve antibiotic. It's not supposed to be used every day. And by reserve, I mean it's supposed to specifically be reserved for anthrax, plague, and pneumonia. It is not supposed to be prescribed for everyday usage. And it's become one of the most prescribed antibiotics in our nation. So in this book, we'll get a little bit into a lot of that information, and some of it's disheartening. There was 21 million associated disabilities with it as of 2011. That's an extraordinary number. Almost 500,000 deaths associated with it just by 2011. And again, that doesn't include the suicides that are often not at all associated with this. So, but there are some interesting things. Now, this book, the reason why I'm encouraging you to buy this, I'm not getting a kickback or anything like that, is because you can highlight stuff. You can learn for yourself, but also you can take this to your doctors. You can make copies of information that's important to you, and you can take it indirectly to your doctor or encourage them to buy it themselves. So here's my first thing I'm going to read to you. FQAD patients whose disease is usually not diagnosed, not named, and if so, not recognized but ignored, have nothing to expect from our healthcare system today. No shit, right? The majority of the costs spent on them concern unnecessary diagnostics where no groundbreaking findings are made, and which even ensures that patients are at best misdiagnosed as psychosomatic, psychiatric, but are often stigmatized as hypochondriacs. So there are 4 categories that FQADS falls into. It's oxidative stress, the musculoskeletal damage and collagen disorder, the neurotoxicity, and the neuropsychiatric adverse effects. So just briefly, I'm going to go through a couple of those areas to highlight this and to get you interested in this book, because like I said, it is gold. So this is talking about the pathogenesis of the oxidative stress factors. So I'm just, again, briefly, obviously this affects our mitochondrial DNA. I think most people understand that, mitochondrial DNA, when it's disrupted like this, when it's affected negatively, it's going to affect you in a way that's going to release, all these downstream effects with free radicals, which your body's going to produce damaged cells. Those damaged cells are now going to go replace healthy cells. Those healthy cells that were generating healthy cells are now generating unhealthy cells. So there's not just the immediate effect of the toxicity that you're going to get, but then the downstream effects of having your body now replicate damaged cells and free radicals. So oxidative therapy is it's one of the things this book talks about the most. And I'm not going to go too much into this because, like I said, you need to sit down with a dictionary, you need to sit down with a pen and a highlighter, make your own notes in this book, and read for yourself. And if I were to try to read a lot of this to you, you would just tune me out because it's too much. But it does talk about, for example, vitamin C and how important vitamin C is, selenium. So I'm going to give you just an example of how this book reads, and I don't want to dissuade you from reading it. This in fact should encourage you to go out and get this book and read it, and to make sure you understand it. Arm yourself with the information so you can have meaningful dialogue with your doctors that otherwise, use jargon and medical language to tune you out, to shut you down, make you feel like an idiot and like you don't know what you're talking about, so you can't have a meaningful conversation with you. Get this book. Arm yourself with the information that you can use. So, but here's just an example just for fun. And if I stumble over a word, I'm sorry. So it's talking about specifically antioxidant therapy. So the prerequisite for this is the presence of selenium as the core metal of all peroxoxides. A major problem is the very stable chelate protein complexes, which FQs form with this bivalent cations, and that just means homogeneous-like cells. So the administration of these metals, especially organic magnesium, might be another option to displace fluoroquinolone from the stable bonds. They are the natural fluoroquinolone competitors at the protein chelate complexes. So what does that mean? So the complex chelate proteins are essentially the bond that holds the fluoroquinolone together with your natural cells. And it's talking specifically about the antioxidant therapies that you can use through diet to disrupt the process that is keeping you disabled or making it worse. So it talks about specifically magnesium causes what's called a closure of your MPTP, which is your mitochondrial permeability transitional pores. So it strengthens that outer bond of your cell to prevent the fluoroquinolone from interacting with your mitochondria. So, and it talks about, in quantitative form, it talks about the benefits of things like vitamin C, magnesium, manganese, copper, selenium, and it's very good. It helps you, you can go through and you're like, oh, glutathioneins, and you can look up foods that are full of glutathioneins and base your diet off that on what you can have and what you can't have. So just in that way, it's very beneficial. But one of the things it talks about is intermittent fasting and interval fasting. And it again specifically talks about peroxide loads. So peroxide apparently is one of the things that your body creates a lot of during this oxidative stress state. And it talks about prolonged calorie restrictive diets and interval fasting and the benefit to that. And I've got another book on fasting that goes into greater detail about the benefits, and it doesn't really get into that. But what it does talk about is the quantitative reduction in the measurable free radical state of your body. So I mean, and the benefits are up to 45% in reduced oxidative stress. So that's an enormous factor. And as you go through this book, it's just got, I mean, I've worn out a highlighter and another ink pen making notes on this, but it talks specifically about your Achilles tendon being 7 times greater to suffer as a result, and it goes into why, and that's kind of what I'm gonna talk about here as well. So, in addition to tendon involvement and tendon rupture and tendinitis, for years the literature only referred to fluoroquinolone-associated tendinopathy. All other collagen-associated tissues are also at risk. Skin, subcutaneous, joints, capsules, ligaments, vascular walls, cartilage, muscle, all can be damaged. So, and I'm not going to go into this extensive list, but it's terrifying. And it talks about, rhabdomyosis, myalgias, there's all kinds of things. So there are some portions out of this I'm going to pull out and read. And this one in particular. And this is during the pathogenesis stage. So tendon complaints occur on average 18 days after the start of FU treatment. Now mine was, on my 3rd dose, so at 12-hour intervals. Mine was 36 hours after, but it even talks about as soon as 6 days in, so, or even sooner. But it gives breakdowns for that, so you can find out kind of what category you're into. And it goes through and it talks about crystalline formations, and essentially what's happening with tendinopathy at the collagen level is it causes it to break down. It essentially eats your collagen. It causes an almost immediate digestion of your collagen as this cell tries to form. So fluoride in itself is a very unstable molecule. It's always looking for electrons. So that's why it attaches and disrupts things so quickly, is because it's a hungry molecule. It's running around your body and it's just grabbing things. And it talks about all kinds of the chemical structure and what it's actually doing at a molecular level. It also talks about caffeine. So caffeine reduces, now if you're like I am with a lot of neuropathy, it's going to aggravate, but it also goes through and talks about specifically how it stalls your detoxification, what's happening at a molecular level, a chemical level, why, what's it doing. So, some more numbers there, and I'm not going to read. Again, I don't want to read the whole book to you. So FQ-induced damage to peripheral nerves has been proven beyond a doubt. About 65% of the reported adverse effects in fluoroquinolone involved in the peripheral nervous system. And this is of the top 50 reported adverse effects, by far the most, and namely about 30% of all effects are neurological. It's a pretty big. And it talks about autonomic neuropathy, gastro and related. So a lot of the same things that your brain is made of, which is what your intestines are made of, which is why a lot of SSRIs and benzodiazepines have a very similar effect on your gut as it does your brain. And it goes a lot into that, how it affects your GABA. And it goes again into therapy, and what, the benefits of certain analgesics are, and why NSAIDs don't necessarily work, and why they can aggravate the conditions. Very good. So it talks about small fiber neuropathy, large fiber neuropathy, and how that's going to affect you. Some of the things, other promising approaches are the acetyl L-carnitine, vitamin E, omega-3 fatty acids, which is one of the reasons why, if you watch my previous video, I talk about salmon. And I can't even say this word, uridine monophosphate. And again, so you can specifically, if you understand the components that are going to help you recover, even at a molecular level like it's talking about, even though that's a little bit scientific, it's going to help you. All you got to do is type in what foods are high in, and again, you can help augment your specific diet. And this is talking about neuropsychiatric effects. So there are usually psychiatric symptoms which the patient himself or herself can not classify, but which further can reduce their acceptance by the medical community, because it's not easy to describe what you're experiencing. So here's some of the things that they talk about in the neuropsychiatric disorders that are described by the FDA. Nervousness, agitation, anxiety, panic attacks, psychosis, hallucinations, paranoia, depersonalization, sleep disorders with nightmares, paresthesia, tinnitus, sensitivity to light and noise, tremors, convulsions, epileptic seizures, clouding of the unconsciousness, memory disorders with amnesia, delirium, depression, suicidal thoughts. And then it goes into suicides under FQ induced are documented. So again, going a little bit further into this, it gets into the the pathogenesis of neuropsychiatric disorders of your brain, and most of it is caused by GABA and GABA receptors being disrupted. Which GABA is essentially what benzodiazepines are. It's a synthetic GABA. So if that in any way helps you understand what this is, so the medication you take when your body can't produce GABA are benzodiazepines. So, and this is talking about it specifically disrupts that. Again, it goes into the reduction of caffeine or the ability of caffeine to reduce your toxicity. And it's talking about reduced caffeine clearance of FQs by up to 84%. So a lot of people, that is going to give you additional considerations. If you are addicted to caffeine, like most people are, now you've got to detoxify from caffeine as well. So that's not fun, right? I've been this whole time 60 days without a cup of coffee, and it sucks. All right, so I'm going to continue here and try to just pull out some from each chapter. So this has a long diagnostic section. And it makes it very easy to check the blocks and find out. And it goes on for pages and pages to help you diagnose yourself, but also to talk to your doctor and help them diagnose you. And it also gives you the information and the ammunition. So it's still going. There's still more diagnostic information. There's just a whole chapter of tables. So, and then it goes into practical experience with between doctors and patients and how they treat this. And this German doctor, they have a completely different approach to this over there because it's a socialized medical healthcare system, which I'm not advocating for. But it does talk about the reduction of productivity of people in dollars and cents, and or francs, or however they count the euro. But it talks specifically about almost the human cost of this, and as far as economic production. So they have a different incentive to quantitate this disability. So just a couple more things, and I'm going to hop off here, and I'm going to make another video when I get done with this treatment, which should not have an immediate reaction. Probably just going to be a slight increase. I'm kind of dreading the trip. Sitting in a seat for a long time is going to be painful. But one of my biggest fears is that I'm somehow treated medically without my ability of a doctor on an immediate or urgent care situation to understand or comprehend, or to incorporate new information from a patient in a distress situation into how they're going to treat me. So I have bought some medical bracelets. I got a medical card in my wallet. I've created one for my wife to carry with me, because if anything happens to me, she's not going to be able to probably accurately describe what's going on, because she can barely understand when I explain it to her. So her ability to regurgitate under enormously stressful environments to a doctor who doesn't want to hear her is going to be a problem. So take precautionary measures to protect yourself and ensure that somehow this situation isn't made worse in an emergency room. So again, this is me at 6 weeks. Hoping to do a lot better when I come back from Minneapolis, and I'm gonna probably take some videos while I'm there and let you guys see firsthand some of the treatments that are offered by Dr. Hansen. Again, if you haven't reached out to Ortho Regenerative Clinic, I think it is in Minneapolis, again by Dr. Ron Hansen, look them up. So just in the last week, I think I've got 5 doctors when I go there for all the different treatments and therapies. Everyone from a chiropractor to physical therapy. They do DMX, digital motion X-ray, they do sonograms, they do a whole comprehensive genetic makeup of you before they even start treatment to make sure they're treating you correctly. And he's been I've been given, I don't want to advertise this too much, his own cell phone. Like, if I have a question and, in the middle of the night, I've texted him and he's responded. So, that much access to doctors, I try really hard not to abuse, but I've been very grateful for throughout this whole process. That is unheard of for me. I've never heard of a doctor being that open and allowing that much access to them. So the attitude by this guy is just all about positive thinking, positive outcomes. it's very refreshing. So, all right. Well, guys, take it easy, and I'll be back with you in a week or two and let you know how everything went. Be good. Be safe.